Sally hasn't been eating well in the past 3 months. She's been full just minutes into eating, and she's been eating about half of her usual intake. She reports no GI symptoms such as nausea, vomiting, bloating, diarrhea. So let's use the decision tree in order to see if and what type of nutrition support Sally needs. Does she have adequate nutrition status? No. That's meaning that she's not necessarily eating enough, her appetite isn't the greatest. So that means that she does need nutrition support. Does she have a functional GI tract? Yes. So she hasn't been experiencing any symptoms that would tell us that her GI tract is not functioning. Does she have a satisfactory appetite? No. Remember, she's feeling full just moments or minutes into eating. Is she physically able to eat? She is physically able to eat. She doesn't have a satisfactory appetite. So that would tell us that she needs enteral nutrition with a feeding tube. The answer is B. Next, we're going to look at how we can determine which type of enteral nutrition or tube feeding Sally will need. In order to do this, we need to discuss whether someone needs short versus long-term feeding routes. Short-term is anything that goes in through the nose, and that would be less than 4 weeks. In long-term tube feeding would be placed surgically, either into the stomach or the small intestine, and that would be something that's been needing at least a month or greater. So we're going to continue to talk about Sally. We figured out that she needs enteral nutrition, and she was actually recently diagnosed with lung cancer. She tires easily. She reports she's less physically active. She reports that she also has anorexia and will start chemotherapy next week. So using the formula selection decision tree, let's see what type of enteral nutrition formula would be best for Sally. Is her digestion and absorption functional or impaired? I'm going to say that it's functional because we don't have any other information that would tell us otherwise. So unless she has some type of history of Crohn's disease or irritable bowel disease or anything else that would affect her GI tract, we're going to consider it functional. Does she have any fiber modifications? And again, no, we don't think that she does. We're going to calculate her nutrient needs. And because she has cancer and because she is starting chemotherapy, we know that she needs both more calories and more protein than a healthy person. So we're going to choose the high calorie, high formula protein, which is B.